Hi there. We're bringing Michelle Gasek to you today. Michelle worked for TRIO for 23 years, providing educational information to the community. She is a licensed professional counselor with certification as a family trauma specialist, and she is also certified as a Montana school counselor for K through 12. Welcome, Michelle.
I would just like you to speak to families and childcare providers and just share with them some important information that can help not only themselves, but help them as they bring children and families back into their facilities. Um, so if you could just speak to the providers and maybe tell them how important that self-care is, because right now they're going to be trying to help lots of others. Can you speak to that for
I,
us?
I think most importantly is that we have a level of acceptance that things have changed. And so we're going to kind of adjust. So maybe creating a sense of normal behavior, as everyone's uncomfortable, the providers are going to be leaders within their group. So people and particularly parents are going to look towards them to create that calm. So one of the things that you can do is that you prepare yourself to welcome those little guys back in, as well as their parents, with things that are set in place so that you have a plan. I think planning is so important so that we're not going in scattered. So people aren't coming to the facility feeling that sense of anxiety and fear, but we actually are opening up our doors with commitment to providing a safe environment for the folks that we serve. And so those folks are going to look at us as we have our calm. And that's where that self-care comes in as a provider. That you do have a plan, that you are reaching out to people, that you kind of know what the protocol is, and you know what the rules and regulations are that have been set up.
Right. So can you
So I
just
just want us to really create that sense of calm when we bring people back into our facility.
definitely. So do you think it's normal for any of us or all of us right now to have heightened anxiety right now?
I think right now there's a sense of the unknown where, we don't know, we don't have a lot of information. And so I guess we are getting more information, but the unknown is really what creates that sense of fear and anxiety. And so most importantly, that we're reaching out and we're developing a plan, looking towards agencies like HRDC, Childcare, to guide us as we open up our doors to bring special guys. Parents are going to have some concerns. Having a list of questions that have answers to them can create that sense of calm. This is something that's new, and we don't know what the outcomes will be, but we know there are definite things that we can do, is creating that social distancing as best as we can, washing our hands, not being around someone who's sick, not exposing others if we're sick. These are some things that we're going to have to keep in our frontal lobe and be mindful of them, and just an acceptance of this is what we're dealing with.
What about, do you, let's see, maybe some people are feeling silly about having the fear and anxiety and dealing with that when they've never felt like that before. Can you just speak to them on what you can tell them?
It's very interesting. It's pretty normal when we're faced in we're thrust into a situation, right? We didn't
Right.
choose this, so we've kind of been forced. So sometimes when we're forced to do something, when we're planners, so we can get emotionally deregulated because we're not in charge. And so that's some normal kind of tendencies that we're humans, right? We're responding to the environment, so it's an unknown. So if we can create some things that make us feel safe in our environment, that's going to make us feel better, like creating a routine, getting good sleep, being mindful, focusing on the here and now, minimizing our interaction with lots of information that's confusing, so we get clear answers from the right people. I think that's really important.
I agree. Those are great tips. I'm going to use them myself. Um, and what should providers tell parents or guardians who are struggling with this newfound fear and anxiety in this pandemic? You talked about them maybe making a list of questions and having some answers. What kind of things should they kind of prepare themselves for that they may need to answer?
So if you're a provider, the questions are going to be coming from parents. So what kind of sanitation are you using? What kind of social distancing are you using? Those kind of questions. I think each person has to kind of identify what those are and create an answer that they feel comfortable giving. Because every person is going to be able to explain to their folks, like they know who comes to their facility.
Right.
They know their families. And so being able to be mindful of the group that they're working with and give them clear answers that are going to make their folks comfortable. I think that's really important.
Definitely. So next, can you tell us about the availability for mental health services that we have here locally?
So here in Billings, folks are conducting business as normal doing telehealth. So they're doing telephone calls, they're doing video. There still are providers that are offering services inside of their offices with social distancing, wearing masks. The governor, has advised that telehealth would be the best mode of operation for now in phase one, if you're able to. So if you can provide remote services, why not do it? Me personally, I've decided to stay home for the next couple of weeks and do telehealth. And it may not be at home, but it may be in an office setting. So here in town, there are lots of folks. If you want to go to Psychology Today, type in Billings, Montana, type in the type of services that you're looking for, you're going to get a whole list of therapists and what their availability is. Riverstone Health is still providing services. So their local Billings clinic, their behavioral health is providing services. St. Vincent is also providing services, behavioral health. And also Walla Walla, which is a social work program here in town. It's actually a school, but you can call Walla Walla and they have free counselors available. And they also have listing of all the area counselors. So there's some resources right there. Again, there's the ability to go to Psychology Today and research what type of therapist you're looking for. You can call Riverstone Health and inquire about their medical telehealth providers and also in-office providers. There's the Billings Clinic Behavioral Health you can go ahead and access, and then there's St. Vincent's Behavioral Health. The Psychology Today is going to list all of those private practitioners that are available.
Okay, great. And we'll put some links up along with this video to the providers so they can.
Very good. And so there's a lot of folks that are still doing play therapy over, telehealth. So they're doing Zoom and they're having all these little guys on and they're doing, play therapy. So if you have little, those services are still being provided. Yellowstone Boys and Girls Ranch, the school-based program, they are still providing services via Zoom. So there's lots of places that you can contact. If you have children that are school age, I would encourage you to contact their school counselor and inquire about what school-based programs are still providing services, because I believe they all are providing services at this point.
Right, that's great. So much information. I'm just going to speak quickly to our providers and give just a little bit of guidance of what we can remember and what children need as they come back and are in their response and recovery stages. As early childhood educators, we can help by developing routines that are consistent daily. Even if those routines are going to become new, we can do those and then consistently carrying them on. And this in and of itself will help the children feel safe. We also know that when the child's social emotional needs are met, there are less challenging behaviors. Less challenging behaviors translates to an environment that feels safe to children. We also know for sure that providers can expect more children will be expressing themselves through challenging behaviors. As early childhood professionals, we know that behavior is communication. As your children exhibit signs of being withdrawn, acting out, or simply moping about, it is imperative to support them. And you can support them by listening and being fully present with each child, validating their feelings and telling them it's okay to feel mad, sad, happy, silly, and angry. Spending time doing calming activities like reading stories and playing with Play-Doh will help children refocus their minds on something else. Remembering that you fill the children's love tanks, and when you fill those love tanks, then the rest of their days and yours, they tend to go a lot better. So just take your time and enjoy the moments, minimize your transitions, and just begin a new normal with your children. And then finally, Michelle, when and how do providers know that they need to refer families and even children to mental health professionals? Are there some common telltale signs that will signal the providers that the family and the child really need help that are kind of on beyond the support that they can give?
I think what you shared, some of the, I want to touch upon some of the things that you shared for providers to offer to children. I also want to recognize that adults can provide some of that as well. Is, being mindful, keeping a routine, doing soothing activities like playing with Play-Doh or fidgeting with something. I think that deep breathing can take some of our anxiety away. So I love that. Some of those same things we can do for ourselves. And touching upon when is it appropriate to refer, I always think providers that have experience will kind of recognize the deregulation, emotional regulation, maybe those real deep feelings of sadness or maybe acting out more. Once you're able to recognize some of those responses, then you as a provider can make the move to offer a referral. But even listening to your folks, and they may share with you, we're really struggling. We're having a hard time finding a balance, of, working full time and homeschooling my children. And I am very, very stressed out. I'm not sure what to do. So listening to your folks and kind of gathering information, your folks that come into your facility. And so if you feel like there's a heightened sense of anxiety or stress or depression, then of course it would be appropriate for you to give them a name and number, or give them just a sheet of resources. Here you go. Here's some folks. A lot of times, if you check with your primary provider, they'll be able to get a referral in real quickly, and you'll be able to access someone. So you don't have to be out there alone searching. You can go to someone you already have a relationship with,
Right.
and ask them for more information. But as a provider, I would just be watchful, listening, looking at behavior that's out of the ordinary that you had never, seen before.
Right. Well, that is great information. I'm so glad we got to talk today. We miss you being in the office.
I feel like I've been in the office. It's just been a different office.
Right.
Yeah, I miss seeing your guys' smiling faces and kind of just feeling that camaraderie and that good energy. So hopefully we'll get back to, our new identified sense of normal, because what it is we're just in transition. And like you said, we're in the recovery portion. So we're coming back, and we're going to have an acceptance. And I encourage all of you to really read about being mindful and being accepting, and also those anxiety decreasing activities like playing with Play-Doh. Those are good opportunities for adults. Doing that deep breathing. I sent you those coping skills. If you could send those to the providers, that would be a great opportunity for them to kind of just learn how to, recognize their own coping skills, and then they'll be able to share it with families and children.
Super. Thanks so much, Michelle. We appreciate you.